The Executive Office of Health and Human Services will hold a series of remote hearings today on proposed regulation changes that could have an effect on services here in Western Massachusetts.
22 News reporter Duncan McLean is live in Holyoke this morning with what to watch out for.
Yeah, Rich, Taylor, these hearings today will be of great interest to local addiction services providers like Mira Vista Behavioral Health here behind me in Holyoke. They were forced to close 60 beds in their acute and medically overseen detox program last month. Now, they could see increased funding as a result of these hearings today, which may be enough to save those programs, though that is still unclear. The program is set to end in mid-July, sending patients and employees to find help and work elsewhere. Today, though, the Health and Human Services Office will hear testimony on increasing funding for that type of program and others. At 9 o'clock, the office will hear testimony on rate changes for substance-related and addictive disorder programs, followed by discussion on services for youth and young adults and intermediate-term stabilization services. Across the board, a 2.78% increase in government funding is proposed for all 5 types of programs. Each individual has specific changes on the table as well. For detox programs like the ones closed at Mira Vista, the proposed amendment would bump state funding for that type by about $11 million annually. Any changes that come from these meetings would be effective July 1st, though it's unclear if that bump in funding will be enough to save the program. The treatment center said in a statement last month that state reimbursement dollars were falling short by millions. Now, these meetings are public access. You can find a link to the Zoom meeting on mass.gov. Just navigate to the Executive Office of Health and Human Services page. Working for you live in Holyoke, Duncan McLean, 22 News.